Dear colleagues, welcome.
Queridos colegas, bienvenido en este webinario sobre trabajando juntos
For this Global Disability Summit 2022. Before we start, I would like to give the floor to Jelena Nikolic that will give us a little bit of housekeeping rules. Jelena, the floor is yours.
Dear all, my name is Jelena. I'm from IDA Technical Support. I'm going to briefly explain some of the technical features of today's call. This webinar is being recorded. There is international sign interpretation and language interpretation in English, French, and Spanish. The interpretation button on the bottom of your screen presents as a globe and will allow you to access specific language channel. Please choose your channel that you will follow through the meeting. Should you have any questions, kindly leave them in the chat box. Our team is monitoring the chat box and we will try to respond to the questions during the event where possible. Should you have any accessibility issues, please send a private message to the host account or email webinars@idap-secretariat.org. We request all speakers to kindly keep to times and ensure that they speak slow enough for the interpreters and all the others to follow. During this meeting, captions will be soon enabled. Thank you for your patience. Have a good meeting.
Thank you very much, Jelena. So in 2018, several organizations made commitment in supporting inclusive social protection for persons with disabilities. Since then, the COVID-19 pandemic has wreaked havoc in the world and has highlighted the importance of social protection. Today, we will take stock of progress made with regard to some of the commitment taken, but also the type of intervention that have been taken during the COVID-19 to support persons with disabilities. And we will look forward in terms of what's next for inclusive social protection with several agencies. I would like to give the floor for the opening to NORAD Director General, Board Vegar Soliel, to give few introductory remarks. Board, the floor is yours.
Thank you so much, and great to see you all on this important event as part of the Global Disability Summit. One cannot tackle the challenges faced by persons with disabilities without addressing social protection. Social protection systems are a key to breaking the link between disability and poverty and to enable participation in the workforce. And social protection systems can facilitate more equal participation in society. The Global Disability Summit seeks to build back better and ensure meaningful and lasting change. It follows from that ambition that social protection is an important area for commitments. Inclusive social protection is not only important from the perspective of disability inclusion, it is also crucial for the success of social protection systems and the economies that they support. These systems cannot leave anyone behind and must succeed in meeting diverse needs. Accommodating the complex and diverse needs of persons with disabilities means supporting countries in striking the right balance between forms of support, cash benefits, in-kind services, and assistive devices. The pandemic, the COVID-19 pandemic, has shown the importance of social protection systems particularly strongly, I think. Countries with established systems have been better able to offset the consequences of the crisis. Investments in social protection is investment in resilience, and we've seen an increase in these systems. The lessons from the pandemic are particularly poignant for persons with disabilities. The ongoing crisis exacerbated differences and struck the most vulnerable the hardest. Better data and early identification are foundational to effective inclusion in social protection schemes. Data is an area of work that underpins all of the themes and sectors discussed around the Global Disability Summit. Knowing the situation and being able to monitor programs is pivotal for policymakers and for civil society. Often, the first step to be included is to be seen, encountered, and recognized. Updated, and I would also add disaggregated data is part of ensuring the social protection schemes successfully meet the needs of persons with disabilities. Another important part is the voice of persons with disabilities themselves, that everyone is involved, listened to, and met with dignity. I'm very happy to be here today at this event that brings together the experiences of persons with disabilities, the expertise from the social protection field, and some of our most important partners here from NORAD. In some way, this meeting showcases the potential for system change that leads to lasting impacts in the daily realities of persons with disabilities. The Global Disability Summit is an important milestone on a much longer journey. The summit and its many meeting points offer an opportunity to take stock, stake out the course, and commit ourselves. To progressively realize the Convention on the Rights of Persons with Disabilities and the ambition of leaving no one behind, we will need to continue the conversations we're having today. We need to continue engaging in the technical aspects, to exchange experiences, learn from each other, and repeat. And this session is part of that important work. And we from Norway's side and from NORAD remain committed to working on this highly important issue in global development also in the future. Thank you.
Thank you very much, Paul, for those very strong introductory remarks. Now I would like to go to the chair of International Disability Alliance, Yanis Vardakastanis, to provide the perspective of the International Disability Alliance, which is the global voice of organization of persons with disabilities. Yanis, the floor is yours.
Thank you. And I would like to thank the organizers for the invitation to my organization to be part of this very important side event on a very crucial area, which is inclusive social protection. And I would like to say upfront that I co-sign everything that was said by the previous speaker. It is so. What is important is to put in perspective the social protection because of the pandemic. Of course, 4 years ago, commitments were made, presented during the first Global Disability Summit. But the world has changed. Even then, we were saying that the social protection systems were not inclusive. They were not supporting persons with disabilities to go easily out of poverty, especially in the developing countries, in the global south. But even in Europe, for example, we were demanding drastic reforms in the social protection to live up to the real needs of persons with disabilities. When we speak of social protection, we really speak of everything that makes a person with a disability able to cope with personal, social, and family needs, with independence. Think of Article 19, for example, of the CRPD, independent living. Think of Article 28, adequate standard of living. Of any rights, we can speak of social protection in a way that has been very much brought to us through the pandemic. We say, for example, that the pandemic has deprioritized lives and rights of persons with disabilities, that the pandemic has pushed into poverty millions of persons with disabilities and out of jobs. Why so? That the pandemic has brought to us inequalities in a more drastic way that were existing before the pandemic. Why so? Because the social systems we have, the social protection system, the welfare state, was weak before the pandemic. It became weaker during the pandemic. And now, one of the commitments that should come out of the second Global Disability Summit is that the reform in the welfare state, in the social protection systems should make sure that persons with disabilities are part and parcel of any reform, with the organizations of persons with disabilities at the table of the decision making. Because human rights cannot be exercised, and I conclude with this, without strong social protection systems. Even if you have the best civil rights legislation, if persons with disabilities are not able to feel secure, independent, and protected, they cannot feel that they can exercise human rights. Thank you.
Thank you very much, Yanis, for those, again, very strong words and very inspiring. You mentioned the impact of the COVID-19, and I would like to give the floor to Veronika Wozak from the ILO to tell us a little bit what are the key lessons learned and the key learnings from the social protection response to COVID-19 for persons with disabilities. Veronika, the floor is yours.
Yes, thanks, Alex. Unfortunately, the pandemic actually has reproduced or aggravated a lot of the problems and patterns that we've seen even before the crisis hit. We see that even before the onset of the pandemic, only about 1/3 of persons with severe disability received disability cash benefits, with significantly lower coverage in low and lower middle income countries, where only between 9 and 11% receive cash benefits. And similarly, there is a lot of inequality regarding access to affordable and good quality health services. And during the crisis, despite overall, on average, an overwhelming investment in social and economic response measures, the distribution of this response, including vaccinations and needed health services, followed the same patterns of inequality between countries of different levels of income. The investment of high-income countries was significantly larger than the capacity of lower-income countries to respond to this. And as a result, people with disabilities in lower and middle-income countries were hit hardest, since they were more vulnerable to the impacts of the pandemic and not systematically included in the design of response measures. We've seen only about 44% of the countries that announced social protection measures referred specifically to people with disability. And in total, only 9% of about 1,700 measures registered addressed people with disability directly. These response measures for people with disability consisted predominantly in cash, sometimes also in kind benefits, either by temporarily increasing benefit levels or by easing administrative regulations to access benefits, for example, delaying the renewal of eligibility verification processes. And only very few countries actually aim to extend schemes to new members. And this was because it was really difficult during the crisis, during lockdowns, to go for extension of coverage, especially because disability registries are still lacking in many countries. And it's difficult to carry out disability assessments during the pandemic. So in light of these challenges, mainstream support measures could have played or may have played an important role also for people with disability. But accessibility of mainstream benefits for people with disability varied depending on country context and measures taken. And also we don't have good data, disaggregated data showing to what extent mainstream measures actually did or did not reach people with disability. And this goes back to what Director Board also said about the importance of data and creating visibility to know the situation. Overall, countries, I mean, this is a lesson that we've already repeated during the last crisis, and we have the same again now. Countries that did have strong social protection systems in place with universal or quasi-universal categorical schemes before the crisis hit, they were able to respond much better. They were able to respond faster and more effectively than countries that only started to introduce ad hoc measures after the shock had occurred. So some key lessons for inclusive shock responsive social protection for people with disability from the pandemic and for the future are, first of all, that the crisis has reconfirmed that disability registries and inclusive information systems constitute a key pillar for social protection systems, that social protection needs need to be better taken into account, in particular as regards disability-related cost, in the design of the package of benefits. And this is not just cash. It's important to also look at healthcare and healthcare costs, at the need for community support services and care services. And all this needs to be factored in when assessing disability-related extra costs. Data collected during the first year of the pandemic showed that disability-related extra costs were significantly increasing during the crisis and during lockdowns. Thirdly, both mainstream and disability-specific schemes need to be made more accessible, removing barriers regarding attitudinal barriers, informational barriers, physical barriers, to really ensure effective access for people with disabilities. And for all these points above, as we've heard from both speakers before, it's important to have direct involvement of people with disabilities and organizations representing them. Of course, in 5 minutes, I can't do justice to summarize the complexities of the crisis and the experience of and the diversity of experience of people with disability regarding social protection response measures. There is a publication that we've done jointly, ILO, UNICEF, and UNPRPD and IDA on COVID-19 in the context of the COVID-19 Joint Program for Disability, Inclusive Response and Recovery. So I'll post a link in the chat box to that paper for those who are interested to read up more on the details.
Thank you very much, Veronica. So you talked about the impact of COVID-19, as Yanis also highlighted. You talked about what we learned from it. I would like now to go to Laura McLean to tell us a little bit more about what SPACE Help Desk, which was set up actually to provide technical assistance in social protection response to the COVID-19, set up by FCDO, DFAT together with GIZ. What has been done to make this work gender responsive and disability inclusive? Laura, the floor is yours.
Thank you, Alex. So as you mentioned, the SPACE Technical Assistance Service was providing support to decision makers with thinking through how to establish, maintain and adapt systems and programs to meet the the growing needs in the face of COVID. So gender and disability inclusion were integrated as a key theme into the help desk from the beginning. And aside from the on-demand support to decision makers at country level, the SPACE team was developed a number of documents setting out key considerations for integrating disability inclusion into design and operations. So that included papers on how to develop information systems in a way that's inclusive and rights-based, and how targeting mechanisms can identify people with disabilities for inclusion. What was interesting was that over the course of the SPACE initiative, which started in April 2020, the team saw gender and disability inclusion grow from something that they had to initiate dialogue on, something that often service users and decision makers were more proactively seeking and prioritizing in the support that they were requesting and received. And they were feeding back on how the guidance and support provided through SPACE was helping to shift the dial on specific issues. So for instance, the paper and advice on inclusive targeting was used to guide activities in occupied Palestinian territories. There are a number of lessons that came out of SPACE's work, both in terms of their engagement with partners and decision makers on COVID response, and on their own experience of integrating disability inclusion into a help desk type of programme. So firstly, in terms of engaging with countries, as has been mentioned, it was really clear that preparedness paid off. Countries which had disability identification mechanisms and registries already in place were in a much better position to respond to COVID by providing fast relief and expanding shock responsive support to persons with disabilities and their families. And the collection of data before the crisis made a huge difference in terms of the type of support that could be provided and the direction that took. In terms of integrating disability inclusion into the assignments, the team found that there was really a need to incorporate disability from the outset and throughout every stage of design and delivery of the assignment and of a programme. And I think they saw most traction on the inclusion of people with disabilities in engagement where that had been embedded in discussions from the beginning. So I think overall, what was interesting was that SPACE did really see increased engagement on a number of requests coming in around disability inclusive social protection over the course of the pandemic. And I think we can really see that as part of a groundswell of work that has been taking place in that area over the past year, and increasing amount of engagement on it.
Thank you very much, Laura, for those elements. And when we talk about the response, we talk about technical assistance, and we talk also about in low and middle income countries, supporting countries that may not have had this infrastructure at the beginning. So I would like to go to David Stewart from UNICEF. David, can you tell us a little bit more about the effort that have been made to support consolidating or expanding cash transfer for children with disabilities or adults with disability during the pandemic? David?
Really, thanks so much, Alex. Everybody, it's really great to be with you. Good morning, good afternoon, good evening. Yeah, we've certainly heard already the incredible challenging situation that COVID has created. We see that for children in general, in particular for children with disabilities. But I'd also echo what Laura was saying in terms of a sense of momentum for the work. And I think we see this in the conversation we're having, but also on the ground in the countries that we're working. And it feels like a shift. I mean, I've been in UNICEF for a while, but it feels like a shift with more demand, more happening, and a greater sense of where we can go. So let me share just a few examples. In one area, UNICEF has been supporting countries with existing schemes to be more inclusive and responsive as part of the response and beyond. So, for example, in Kenya and Zambia, we supported a top-up grant to households that include a person with disability that was currently enrolled in the existing safety net program. In Zambia, we supported an expansion of the cash transfer response to new households with persons of disabilities, and also the translation of communications materials into a variety of accessible formats, as well as working to make the grievance and redressal mechanisms more flexible and inclusive. And in Jordan, another example where we modified an existing program, modifying the targeting criteria to account for disability-related costs. So there's quite a lot of work in the area of where there are existing programs working with governments to make them more inclusive. In some countries, we supported new temporary schemes. So in the Dominican Republic, for example, we supported a cash transfer for households with children with disabilities in response to COVID-19. And now using the work done and the lessons learned to work towards developing a sustainable program. And that's often an approach we take when we start these new programs to see where the linkages can be. Finally, we also have been working, and we do work in humanitarian contexts, so in cash transfer programs in Yemen, Madagascar, and in Syria, for example, we have developed a specific cash transfer for children with disabilities, and which supports access to health and education services, and now working with the government to sustain that scheme in case management approach, so similar to the Dominican Republic, starting and then building towards sustainability. So we are seeing positive momentum, but of course the challenges are very great. Alex, back over to you.
Thank you very much, David, for those elements. So we talked about COVID-19, we talked about the importance of having strong social protection systems. I would like now to go to few speakers to discuss those elements. And I would start with Gustavo De Marco from the World Bank. Gustavo, in 2018, the World Bank committed to make 75% of its social protection program disability inclusive by 2025, which is a major undertaking and commitment. Could you share with us, considering the impact that the World Bank has on social protection and the importance of its investment, could you share with us the steps that you have taken, and also what would be some indicators to monitor the progress? Gustavo, the floor is yours.
Thank you very much. First of all, thanks to the team that organized this important event, and happy to share some of the progress we have made at the World Bank towards achieving the ambitious objective of having 75% of the social protection programs being projects being disability inclusive. This is in the frame of a broader commitment the World Bank took in the 2018 World Disability Summit, which also includes 100% of education projects being disability inclusive, and other objectives pertaining employment and other programs. So I'm going to talk specifically about the social protection and jobs agenda. The first task we took is to prepare disability inclusive projects guidelines for task managers. This was something very important because the level of awareness of our task managers is very low. This is reflected in the low number of projects and the big tasks that we have ahead of us to achieve these goals. So the guidelines, our guidelines, indicate the areas of engagement where we expect our projects to be more disability sensitive and disability inclusive. And this includes basically 5 areas of income support, long-term and social care, rehabilitation, skills development, and employment opportunities. So the first thing that we have highlighted in the guidelines is that in order to achieve the ambitious objectives of 75% disability inclusive projects, we need to be also comprehensive and try to make use of the experience the bank has and other organizations have developing, supporting projects in some of these areas. Of course, in addition to this, the COVID-19 response required some additional efforts, and there has been some efforts to try to identify what are the specific actions that could better support disability and inclusion in social protection during the pandemics. And this includes improvements in needs assessments and conducting needs assessment to identify people's need to, if full disability assessments are not possible due to the situation of emergency during the pandemics, the guidance we have provided is to fund and then verify, so not stop the projects because of the lengthy procedures, and to try to adapt the assessment tools in a way that they would not exclude people with urgent needs because of administrative procedures. Another element of the guidance that is specific to the COVID-19 response is to try to maximize the use of public works to meet the care agenda. As everybody knows, a lot of the efforts made by governments and supported by institutions like the World Bank have been to upscale the response of some traditional safety nets projects like cash transfers and public works, and we have encouraged our teams to think of addressing some of these needs through disability inclusive projects. Accessible communication using technology, access to technology is another challenge for persons with disability to access social protection programs, and this has also been the focus of our work. We are a small group supporting centrally the disability and inclusion agenda, but we are working with regional colleagues, because at this point monitoring the progress towards the achievement of the disability inclusive projects is still a bit early, since not early. I mean, it's always timely, but we need to do some foundational work, and this foundational work includes the engagement and sensitization of the task managers, practice managers, and regional teams. We have identified 4 entry points in our guidelines. So one of them is to define a disability inclusive project. One is stakeholder engagement, making sure that all the social protection projects have the involvement of relevant stakeholders for programs with persons with disability. Second is having some disability sensitive analysis. We know that data and analysis on programs for persons with disability are poor, incomplete, but this is an important entry point. And then disability inclusive design and measures to assess the level of programs. Let me just mention that we are also using a twin approach to disability and inclusion, and this includes distinction between mainstream schemes and disability specific schemes. So we have to be comprehensive in the way we define disability inclusive projects, and we are guiding our teams to try to identify those programs that are mainstream and differentiate from those that are disability specific schemes. Both will count towards the 75% objective. Last thing, I know I'm running out of time. Let me close with some monitoring actions. At this stage, we are getting involved in the entire project cycle. We need to do this investment given the initial phase in which we are. So we are participating. We as team with our regional teams, regional supportive teams, we are participating in the project design. From the project design, we are encouraging the inclusion of disability as mainstream or as specific objectives. And we are following with the regional teams with a series of meetings and events to make sure that the process will continue moving forward. Thank you.
Thank you very much, Gustavo. And I would like to go to the Asian Development Bank with Michiel van der Overa to tell us a little bit more about the work that has been done on some of the commitments taken in 2018, especially around the social protection indicator. Michiel, the floor is yours.
Yeah, thank you, Alex. ADB indeed made 9 commitments during the Global Disability Summit in 2018. And the first commitment, which really steers all other commitments, was the adoption of an ADB Disability Roadmap. This roadmap has the intention to increase awareness and to build capacity on disability inclusion within ADB for the next 5 years, from 2021 to 2025. The roadmap has 5 components to introduce disability inclusive development approaches in ADB operations, but also to build an inclusive organizational culture within ADB. One of these components focuses on the establishment of a culture of data disaggregation and the publication of disability-sensitive analysis. And the work of the social protection indicator is central to this component. The Social Protection Indicator, or the SPI, is an ADB flagship initiative on social protection. The SPI database and reports have become a unique source of social protection statistics in the region, providing robust data and a strong knowledge base to support development of social protection in Asia and the Pacific. The SPI reports provide an analysis on expenditure and coverage of social protection across the countries in the region, with disaggregated data on poverty and gender. The SPI was first piloted in 2002 in 4 countries, and then rolled out in 2005 across Asia and the Pacific. In 2009, the methodology was simplified. And since 2009, every 3 years, we do a new round of data collection for the SPI. So we have now a 10 years timeline where we use the same methodology, and we can kind of compare over that time period. We are currently working on the regional reports for the 2018 data of the SPI. So for the 2018 data, ADB committed to pay extra attention to the collection and analysis of disability data. For reporting purposes, we included the disaggregation of disability data with some challenges. While disaggregation for gender is straightforward, and for poverty is already a little bit more difficult, for disability, it's even more complicated because the data are fairly incomplete. But despite these data constraints for disability disaggregation, we can see that many governments in Asia and the Pacific have taken steps towards including the Washington group questions in the national census and in other surveys. And this over time should help to improve the data disaggregation. We have undertaken analysis of social protection programs in Asia and the Pacific region to identify disability targeted programs and to try and understand the extent to which people with disabilities are accessing mainstream social protection measures and programs. We also found some universal disability programs in selected countries, but the majority of the countries do not provide such a benefit. And we also noticed that between 2009 and 2018, overall expenditure in Asia and the Pacific region on disability targeted programs has increased. But this increase obviously only started from a very low starting point. So to conclude, more work needs to be done to explore the adequacy of social protection for people with disabilities and to continue to improve disability disaggregation of data in social protection. We are cooperating with our colleagues from UN agencies, civil society, and multi-donor banks on how best to support country systems to provide better income security, but also better coverage of healthcare and disability-related costs, as well as social services for people with disabilities across the life cycle. Over to you, Alex.
Thank you very much, Mikhail. Staying in the region, I would like to ask Felicity O'Brien from DFAT, Australian DFAT, to tell us a little bit more about the work that has been done to support mainstreaming of disability into some of the flagship social protection programs that DFAT is supporting. Felicity, the floor is yours.
Okay. Thanks, Alex. So across Australia's development program, disability inclusion is a significant priority and cross-cutting sector across all our activities. So DFAT has focused on a twin track approach to disability inclusion for quite a while. Many of you would possibly agree that mainstreaming efforts can often be the most difficult area to gain traction for both disability inclusion and gender equality. So DFAT support to mainstreaming efforts has happened across a range of programs in Indonesia, ranging from law and justice programs to their economic development and reform activities. But I'll just focus in on one in particular that has had some really terrific outcomes. So the DFAT funded program, which is called Towards a Strong and Prosperous Indonesian Society, or Makota, which supports the government of Indonesia to improve its social protection systems, to reduce poverty and inequality, and ultimately achieve inclusive and sustainable economic growth. So Makota program supports the government of Indonesia to implement social protection programs and policies that are inclusive of the rights and the needs of people with disabilities. Makota has contributed to the development of the content of government regulations to the National Disability Law, and specifically the government regulation on the provision of social welfare for people with a disability and the provision of habilitation and rehab services. Makota provides a range of inputs to facilitate and strengthen the engagement between the government of Indonesia, particularly the Ministry of Social Affairs as the lead agency for these disability regulations, and also with civil society stakeholders, including the disabled people's organisations. So this is with the intention of developing the regulations to a mutually acceptable end product. One of the key contributions of Makota to drafting these government regulations was that it brought the important voices of people with disabilities to the discussions, thus ensuring that the drafting process stayed true to the core disability inclusion principle of nothing about us without us. Makota supported the regulation drafting process at all levels, so through technical assistance, facilitating collaboration of stakeholders, advocating to agencies for the integration of inclusive social protection, and also financially supporting key meetings and accessibility requirements that were needed. The objective was to ensure that there was a more accessible environment for the DPO representatives to participate. Another really important element of the Makota program was around the strengthening of the disability data. So Makota supported the Indonesian government to develop a new disability survey and then integrate the data from this into the Indonesia's national database for vulnerable groups. This was done in partnership with the disabled people's organisations and disability experts. The aim for the Indonesian government was to leverage this data to ensure greater access to social protection and other government services and supports for people with disabilities. The Makoto program provided technical advice and support, and again, worked really closely with international disability experts and representatives from the organisations of people with disabilities. And it also worked with the government ministries to improve the quality of this survey instrument, and by developing and reviewing and evaluating it with the scoring mechanism. An evaluation of the Makoto program is actually on the DFAT website if you wanted to read a little bit more about it. But DFAT support for social protection programming and technical support has increased significantly since the onset of the COVID-19 social and economic crisis. So this requires that we're taking a mainstream approach alongside a lot of targeted activities to ensure that people with disabilities are not left behind. So in the Pacific, DFAT's also supporting a technical facility called Partnerships for Social Protection Program. And this program will be supporting bilateral governments to scale up and develop their social protection programs. So through this new partnership, DFAT is supporting the design and delivery of inclusive social assistance schemes. And for example, it's helping to design a new benefit for early childhood in Timor-Leste, which includes higher amounts for children with disabilities, recognising those additional costs that are related to disability. Thanks, Alex, back to you.
Thank you very much, Felicity, for those elements. I would like now to go to Verena Damerau from GIZ to tell us a little bit more also the work that GIZ has been doing in trying to make social protection more inclusive. Verena, the floor is yours. You are muted.
Does it work now? I tried it already. Yeah, it should work. Do you hear me well?
Yes.
Great, thank you. Thank you, Alex. Good morning, afternoon, evening to everyone. The German Technical Cooperation, GIZ, supported social protection systems in different ways. We have already heard from Laura, for example, from FCDO colleague, that GIZ jointly supported together with DFAT shock responsive social protection systems during this pandemic, but our emphasis is mainly on the operationalization of disability inclusive social protection systems through disability inclusive programming, which is aligned to German Development Cooperation's commitment, building greater consensus on the importance of this topic to supporting the full and effective participation of persons with disabilities. We are gathered here because we are well aware that this is still a challenging and serious topic we must tackle, as almost every 4 women in low and middle income countries live with 1 or more disabilities. As part of our steps, a range of appropriate measures have been created to effectively ensure and encourage colleagues and partners that social protection interventions include persons with disabilities and their needs. I would like to particularly set the focus on 4 main aspects that hopefully remain with you in these 2 remaining minutes that are of great importance for GIZ. On one side, capacity and awareness is the first aspect I would like to strengthening, that disability inclusion competences among project staff and stakeholders is essential, anchoring disability awareness among the development of our own staff capacity, but also the general public and the government officers who implement social protection programs is essential, and that is with specific guidances, checklists, and sometimes questions for planning and implementing social protection programming in a more disability inclusive manner. I left a link to the brochure where you can see also some examples of questions that you can pose yourself as just one example of a brochure we have produced for this. The second aspect is adequacy and accessibility. Ensuring disability-sensitive design and delivery modalities is essential. Participation is the third, involving persons with disabilities in the governance of social protection in various moments of the project cycle, but ideally from the beginning onwards, such as involving DPOs in our own appraisal missions. And the fourth and the main and the most important is data monitoring. One of the key barriers to disability-inclusive social protection planning is the lack of data on the social protection needs of persons with disabilities and the challenges experience in accessing social protection programs. An effective way to start addressing this would be to include disability-specific data in social protection data collection. Including disability-specific indicators is key on one aspect, not only in the programs and project objectives, but also in the monitoring mechanisms and promoting data disaggregation by disability through disability registries, highlighting the Disability Management Information System as an example that Rwanda's National Council of Persons with Disability has and will have a session today in the afternoon. I encourage you to register to that one. And the last point would be that it also to capitalize on the advantages of digital tools that allow the possibility for an integrated beneficiary registry. With that, I'm happy that you further expand in the brochure and are open for questions if there's any space at the end. Thank you. Alex, over to you.
Thank you very much, Verena. We talked a lot about disability identification, disability registry. I would like to go back to David from UNICEF to tell us a little bit more the work that has been done to support disability assessment. David, the floor is yours.
Thanks so much, Alex. Yeah, this is indeed a really, really important area. And the example I gave before of the Dominican Republic was only possible because we had worked on a unique social protection registry to include questions to identify households with children and adults with disabilities back in 2018. So that foundation is really crucial. And in recent years, we've been supporting reform to align with CRPD requirements of existing assessments in Europe and Central Asia in countries like Armenia and Georgia, but also to develop new mechanisms from the start. So in Cambodia, for example, we're working on an app-based disability assessment tool to provide us with that information. And in all cases, we're trying to ensure that assessment mechanisms are more accessible and take into consideration the support needs of children and adults with disabilities and are reliable so that government can build on them to develop schemes and services. So we're working with UNESCAP to produce an overview about how some countries are working towards more accessible, comprehensive and reliable disability assessment in low and middle income countries in line with the CRPD. For children, we're also working on the critical issue of early identification. This is a really, really important issue in many countries. And finally, just to point to another important focus, this is an initiative with colleagues from the World Bank to develop a common methodology of disability-related costs faced by children with disabilities, and working on assessing the impact of disability-related costs on child poverty measurement and the implications for the expansion of universal child benefits and gender-responsive access to community support and care services. So these are really going to be our priorities in this area in the coming years. Alex, back over.
Thank you very much, David, for those elements. So you just mentioned the importance of cost of disability for children and their support. I would like now to discuss, to ask Alexander Obinka from GIDEF to tell us a little bit more about the employment side. We talked originally about income support, but also inclusive employment initiatives. So Alexander, could you tell us a little bit more about what GIZ has been doing with that regard? Alexander?
Yes. Yeah, good afternoon. Thank you so much, Alex. Actually, okay, GIZ, as you know, as the German Development Agency for Technical Assistance, orients its work to international frameworks and instruments, as Verena also told you, UNCRPD, ILO core standards, and also to national policies and legislation in our partner countries. Something which is quite positive at the moment, I would say, during the last years, the GIZ portfolio in the area of employment promotion, labor market, and TVET, as technical education and vocational training, is steadily growing. Besides human rights and gender, inclusion of persons with disabilities is treated as a prioritized mainstreaming topic, which should be systematically based on the guiding BMZ inclusion strategy, integrated in existing and new programming. Particularly interesting for us today are those approaches which combine elements of social protection with employment promotion programming, such as public works, cash for works, return to work, rehabilitation services for persons with disabilities, and also peer-to-peer counseling for inclusive placement service, for example. I would like to put now an emphasis on two disability inclusive programs in Bangladesh and Indonesia, which have developed quite successfully social protection oriented approaches in connection to employment measures in a, I would say, in a creative and effective way. First program is, maybe some of you have already heard about this program, promotion of social and environmental standards in the ready-made garment sector in Bangladesh. It is a program which has a long history. After the horrific accident in Rana Plaza in 2013, the political leaders in Germany and also Bangladesh gave a clear priority to develop social standards for the textile sector in Bangladesh. And three key elements of GIZ contribution I would like to specify here. First of all, on the level of partnership or collaboration, the project established an institutionalized cooperation and dialogue format between the government, private enterprises, and representing organizations of persons with disabilities to ensure expertise regarding the needs of the target group. The second element is vocational rehabilitation. In the first phase, the project offered to people with disabilities who did not want to return to their former jobs or needs-oriented vocational rehabilitation. Further, also traumatized victims also received, in this case, a medical treatment and psychological support. And then the third element, which is maybe the most important here, was the establishment and development of an inclusive job center. This job center was open to connect persons with disabilities to vocational training and support them in finding employment in the garment industry. What were the main elements of this job center? The panel. Yeah, I have to finish.
Yes, please.
Oh,
thank you very much.
My God. Okay. Okay. Let's say they were quite connected to 200 factories in the garment sector. So they identified persons with disabilities and brought them in jobs and back to work, and offer them also rehabilitation services, which was quite a new aspect. And this was the idea was also from the Bangladeshi government to scale this approach up on the national level and bring it also to other countries.
Thank you very much.
Yeah, the second. Okay, I have to finish.
Yes, please. No, thank you very much. Apologies for that. We talked about children. We talked about older person. I would like now to talk about the critical issues of older person with disability, and I would like to go to Laura from FCDO to tell us a little bit more about the work that has been done in Uganda with regards to the old age pension. Laura, the floor is yours.
Sure, thanks, Alex. So yes, FCDO has been working with Government of Uganda on developing their social protection system since 2010. So the current programme to expand social protection is a partnership between the Ugandan, British and Irish governments to deliver a senior citizens grant. So at the 2018 Global Disability Summit, Government of Uganda committed to making social protection more inclusive. And as a follow-up, the various governments have been collaborating to take the opportunity of expanding old age grants to see how we can support greater inclusivity, both by considering ways to make the Senior Citizens Grant more inclusive and accessible, and by supporting government's policy level activities around social protection. So following a pilot, there was a national expansion of the Senior Citizens Grant to all people over the age of 80. And there's now been agreed to roll that out to everyone over 75. That rollout was a really good opportunity to advance progress in ensuring implementation was disability sensitive. So a key addition to the delivery was the introduction of home enrolment processes as a possibility to tackle barriers that individuals with mobility issues faced in accessing central enrolment points in community spaces. Secondly, there was also the introduction of the possibility of individuals registering alternative recipients of the grant to allow for more flexibility in access. Thirdly, there was a big push to link up grant delivery with other FCDO funded programs focused on services and interventions to improve well-being of people with disabilities. So for instance, linking up with an initiative being implemented by Site Savers, where grant beneficiaries can be tested and treated for eye-related health issues at paypoint sites. So I think key lesson that came out of that was that unless other accessibility and vulnerability factors were considered, it was very easy for some individuals to be left out of the supposedly universal coverage of a senior citizens grant. However, just to note, there are still challenges around integrating disability-related costs. That's not being factored into the support provided by the grant at the moment. So that's a continued area of focus and key priority as discussions continue on how to make sure that that grant is really supporting inclusion. Thanks. Back to you, Alex.
Thank you very much, Laura. And immediately I would like to go to Meredith Wise from ADB. We talked a lot about cash and support, but we talked also about services. And we know that this is a critical issue for older persons with disabilities. Can you tell us a little bit more about some of the work that took place in Asia and the Pacific? Meredith, the floor.
Sure, thank you, Alex. Yes, given the rapid demographic transition in the Asia-Pacific region, adapting to aging societies has been incorporated into ADB's overall strategy 2030. And developing care and support systems for older persons with disabilities are an important component of this adaptation. In response to your question, I'd like to present 3 areas of our work. The first area to highlight is technical assistance to the planning process for care and support system development. In several ADB member states as diverse as Mongolia, Indonesia, the People's Republic of China and Tonga, we've supported the development of national or subnational plans on care and support. These strategic plans include a prioritization of services with a focus on home and community-based care and support. And they also include the actions to realize enabling strategies required to build an effective system, such as on governance, human resources, financing, quality management, and of course, collaboration. Key to this planning process has been the facilitation of a participatory and cross-sectorial discussions to develop, firstly, a common understanding of what care and support services for older persons with disabilities could be, and to identify a vision. And secondly, to really clarify the role in the system of different stakeholders, such as government, CSOs, the private sector, communities, and of course, individuals. We do see these plans as a key mechanism to help translate policies, of which many of them do exist, into practice. The second area of our work to highlight is really focused on demonstrating effective integrated care and support service delivery. Our work to date ranges from a substantial portfolio of projects in the People's Republic of China to the development of government CSO partnerships to provide services in Tonga. And now we're supporting the piloting of integrated community-based initiatives in several countries, such as Indonesia, Vietnam, and Mongolia. At the heart of these pilots is really sort of using an asset-based approach to develop care and support services, promotion of case coordination through case management, building capacity in new areas such as dementia care, and of course, learning. The last area to highlight is really the promotion of regional knowledge and regional learning across governments and other stakeholders in the Asia-Pacific region. This is an area where there is a huge thirst for knowledge and a strong interest in learning from others. So through knowledge products, events, and network building, we are striving to produce and share useful resources to really highlight and effective practices emerging in the region and promote collaboration to really accelerate action in this very underdeveloped component of social protection systems. We look forward to collaborating with many of you in these efforts. Thank you.
Thank you very much, Meredith, for those elements. Across all those presentations came the issue of participation of organization of persons with disabilities. And I would like to go now to Al-Hadi Abdallah from AIDA to tell us a little bit more about the work that has been done lately to support engagement of persons with disabilities in social protection reforms. Al-Hadi, the floor is yours.
Many thanks, Alex. As you know, AIDA has been consistently working on social protection. However, in the last 3 years, AIDA have been working more intensively on social protection. Social protection really show the interest of OBDs and the need for disability inclusive social protection In response to that, AIDA has been working with OPDs to develop their capacity and to engage, to support their engagement with different stakeholders and to raise the voice of persons with disabilities at global level. So in this regard, AIDA has developed training curriculum and has been implemented this training in different countries. I'm happy to see some alumni of this training attending this webinar. Also, now AIDA is developing online curriculum with partners to be shared in AIDA online platform, which will be launched soon. In this regard, also AIDA mobilized OPDs from different parts of the globe to engage with the Bonn University course on social protection to learn more about system building regard to social protection, and also to share their experience within the training itself. To have those trainings delivered in high quality, AIDA, in partnership with UNICEF and ILO, has online process for training of trainers, for facilitators of the training. So by the end, the training of AIDA is being delivered by persons with disability who have lived experience, who have also been trained with experts. Furthermore, AIDA engage with its members in different parts of the globe to raise their voices as well. For example, AIDA engage with our partner TCI Asia and also our member Asian Disability Forum and run series of workshops, online seminars, and so on, in order to highlight the need for disability inclusive response to COVID-19. And this consultation result in publishing a report on Southeast Asia response to COVID-19 in regard to persons with disabilities. In Africa as well, AIDA work with African Disability Forum, organize regional workshop, and after with UNICEF and ILO and EU initiative Bridging the Gap, and organize a conference which aims at having platform for policy dialogue between persons with disabilities and different actors. And in that conference, a call to action has been launched by African DBOs to call for disability inclusive social protection in Africa. Furthermore, all alumni of the capacity building have been formed in a community of practice mechanism. In this community of practice, AIDA can offer consultative and support for partners in where partner can provide us with document, presentations, publication, and so on. And the community practice can review and provide feedback from the disability perspective. And also this, we see it as further enhancement of the disability movement to engage in such publication and so on. By the end, I would like to say that AIDA has been working on social protection, raising the voice of persons with disabilities, support its member and members to be engaging further with the social protection. And in this regard, I would like to say thanks to the UN PRBD project with UNICEF and AIDA, which has supported this a lot. And also, I would like just to close my speech by saying that AIDA is committed to continue raising the voice of persons with disabilities and to work more in enhancing their capacity and have further engagement with different stakeholders at different levels, national, regional, and international. Thanks.
Thank you very much, Alradi, for this. And without any further ado, I would like to go to Valerie Schmidt, who is the Deputy Director of Social Protection for the ILO, to tell us a little bit about the work that has been done since the adoption of the joint statement to build capacity of stakeholders and also to close this event. Valerie, the floor is yours.
Thank you, Alex, and thank you, Alradi, for mentioning the UNPRPD project that I'm going to talk about. So following the adoption of the joint statement in 2018, the ILO received funding from the UNPRPD to implement with UNICEF, AIDA, and many of you, the program called Towards Inclusive Social Protection to Advance the Rights of Persons with Disability. And with this joint statement from 2018, we had reached consensus on what countries should do to leverage social protection systems for the inclusion of persons with disability. And thanks to our UNPRPD program, we have been able to work and focus on how this could be achieved, with a strong focus on documenting country experiences and building evidence, as well as strengthening capacity. So we did all of this, of course, with a strong participation of organizations representing people with disability. So we developed a series of background papers that address important issues regarding social protection and disability. We also developed a core course on disability and social protection, and we have trained together with Bonn-Rhein-Sieg University 3 cohorts of students. And we are really lucky that NORAD will help us to do another edition of this course this year. Another key product of this UNPRPD project was a guidance note that we have started working on, and that will be finalized, reviewed through a number of consultations this year with all of you. And we plan to publish it by 2030. And this guidance notes will be very useful at country level to really implement this inclusive social protection. An important point, during the International Labour Conference in June 2021, all our ILO member states represented by governments and by also trade unions and employers associations had a very important discussion on social security. And they have agreed by consensus on a series of conclusions that will drive our work in the next 5 to 10 years. And what is very important for the discussion of today is that among these conclusions, there was a very strong paragraph, and I'm sure that my colleague Veronica will share a link, calling on the ILO to support countries in ensuring that their social protection systems are inclusive of persons with disabilities and support their full inclusion. So with that, as a starting point, now what are we going to do in the coming years? So we at the ILO remain firmly committed to working jointly with all of you to further strengthen social protection systems and to work better for the inclusion of people with disability in the spirit of the CRPD. So we will focus on 3 areas. First is data. As mentioned by Verena, by Michael, by many of you, it is very important to improve the availability and quality of social protection data on persons with disabilities. We are not starting from zero. We have a World Social Protection Database that provides information on all the social security systems around the world. And of course, we are going to improve this database. Second, we will systematically integrate disability inclusion into all our policy work, or we will try, and also in the work of our global partnerships, such as the SPIAGB and USP 2030 that we are co-chairing with the World Bank and where UNICEF and many others are key partners. And third, we will systematically integrate disability inclusion in our flagship program that helps us to provide support to countries through development cooperation projects. This flagship program has now a new phase that has started in October 2021 that will focus on at least 50 countries and has a number of thematic focus, and one of them is on disability inclusion, inclusive social protection. So as a closing remark, I would like to thank all of our partners for this great event and this great collaboration in the context of the UNPRPD program. We look forward to the immediate next step. We are jointly organizing, as many of you know already, an important virtual global conference with socialprotection.org that will take place on 16 and 17 of March. And I think Veronica will share the link so that you can all register and hear from many country experiences that will be expressed during this conference. So thank you so much, Alex. Thank you so much, all the organizers of this important event. Thank you.
Thank you very much, Valerie, for those closing remarks and this presentation. I would like to thank you all the speakers and all of you who attended this session. Thanks also the interpreters and for both sign language, the captioning and language, as well as the team of the International Disability Alliance, without which this program would not be possible. We wish you an excellent day, evening, night, and look forward to meet you all at the Global Conference in March. Thank you very much.
Alex, thank you. Thank you, everybody.
Thank you so much. Bye-bye.